and maybe I didn't get the support from social services that I should have received.
Yes.
Mainly because, sometimes the process is that long.
Yeah. Well, let's talk about that, because
Okay.
you've got a special insight, having worked in social services as a social worker previously, and then you change your role a little bit. What tell all the viewers what you were doing work-wise before your diagnosis?
I used to work for Nottingham City. Well, I still do work for Nottingham City Council as what's known as a community care officer. And what my job entails is carrying out needs-led assessments of citizens that have a need. So it might be an older person, a person with a learning disability, Asperger's, any adult that is over 18 and in need of social care.
Yeah.
That would be my role. And I would also make referrals and signpost on to other agencies, e.g. for benefits advice, occupational health assessments.
It sounds like a fulfilling role. Did you used to enjoy your job?
Yes.
And what was the effect of your diagnosis on being interrupted in that role? Did you have to take a break from work?
Yes, I was off work for nearly 15 months.
Yeah, so that must have been difficult on its own.
Yes, because a lot has changed and happened in the job. The processes have changed. So it is very different now.
Did your role change when you went back to work?
No, I'm still doing social work, but the emphasis is more on sort of throughput. Whereas prior to, it was more person-centred, and you had that time and luxury to spend with the citizen.
I think I know what you're saying.
And doing the job, but it's now sort of more
about numbers.
Targets. Yeah. And I'm sorry, I'm a bit old school in my working. As I said, I love my job. I mean, I had the option that I could have been retired on ill health grounds.
But as I said, because that's very interesting, that choice.
Yeah.
Given your condition is quite advanced in a way, but you actually didn't opt for that choice.
I didn't opt for that choice because I loved my job.
Yeah.
And for me, accepting that choice is saying the cancer's won.
For you, it was better to be living with the cancer and back at work than being off and not knowing what to do.
Yeah, well, it would. I mean, yes, I would have been able to find other things to do, but for me, this cancer, it's impacted in my life. It's not going to rule my life, and it's not going to rule me and dictate to me what I'm going to do.
It sounds like you wanted to keep control over your life rather than the cancer being in control.
Yes.
Is that fair enough?
Yes, that's a true statement.
Yeah. Now, so let me ask you about this special insight you have about being a social worker, and yet you had needs. You actually already said in your account that there was a point in hospital where you had to draw attention to some needs, but later on, or even at home, do you think that, I mean, this is a big question now, but do you think we're addressing the needs of patients in the community who return home, and they might not need acute medical care, but they've still got in the background their chronic condition?
No, I don't feel so. I think a lot more could be done. I was in a fortunate position because I worked within that environment, so I had more insight. So, for example, my house has got very steep stairs. I have a special toilet downstairs and a washroom downstairs, and I also have a bathroom and a toilet upstairs. But even so, I still had to have a commode upstairs, and then getting up, because I've got arthritis anyway, I need a bed lever to help me to sort of get up and out of the bed. Clearly, this was all equipment that I had to be saying to them, look, these are my difficulties. These are the problems that I can foresee.
Yes.
Because at this point, I hadn't had an occupational therapist assessment. The bit of occupational therapy assessment they gave me was using the hospital stairs, which was no way in comparison to my stairs, because back in the day occupational therapists used to be able to do home visits
Yes.
with patients.
They used to, yeah.
And that way then you're seeing the patient in their own environment and getting a true inkling of what they can and can't do. The hospital stairs has got no way comparison to my stairs. My stairs at home are really steep.
Yeah.
Yet they were wanting to discharge me. And I said, no, you know, I know I won't be able to do my stairs because I struggled on their stairs, albeit that I did it, but it was a struggle.
So would you like to see some change in the system that we have?
Yes,
to
definitely.
improve the assessments and the provision of care, meeting that gap in unmet
I think
needs?
there needs to be a designated, whether social worker or a couple of social workers within the hospital that are their specific responsibility is to deal with people that have cancer.
Yes.
It's not, shouldn't be just reliant on the generic teams
They're probably overstretched.
to do that, because there is not enough workers to deal with the volume of work coming in, and the need of those people that are terminally ill is so specialist, and sometimes quick response is needed.
Is there anything obvious that you change in the hospital or community system? You know, if hospital planners or etc. are watching this.
I think what they need to do is they talk about working in partnership between health and social care, and there are some very good projects. So for example, within Nottingham City Council, we've got like the crisis response team, which is made up of health professionals, and it's also got social workers within that team. But at the same time, I think within the hospital, they need to have their own specialist team specifically for patients that have a terminal illness, and they shouldn't be linked into the main team. It needs to be a specialist area, because the needs are specialists. They're not the same as, you know, an older person or somebody that's got dementia or somebody that's fractured their hip. You know, this is a longer term problem, and also there's the emotional and psychological effect, and again, that's not necessarily taken on board when people are doing all of these assessments, because there is a bigger picture that has to be considered, not just the person at that point. It's the wider implications on the family and the family dynamics.
Quite right. It's not just the individual. It's everyone that's affected by the illness.
Yes.